Good afternoon, everyone. Happy Friday. Brandon Garrett here with the National Minority Quality Forum. So if it's Friday around noon, on the East Coast at least, we're doing a webinar trying to just educate and edutain and whatnot, talking about some of the things that we're working on. Before we get to the program itself, I just want to have a couple of announcements, and you're going to hear these for a minute until it happens. But on April 28th and 29th, we have our annual summit on health disparities. It'll take place here in Washington, D.C. And if you're interested in registering, please, we'll put a link in there. And we have one more week for nominations for our 40 under 40 program. This will be our 10th class. So after this class, we'll have 440 under 40s, I guess, roaming the country doing healthcare work. And so just encourage you or anyone you think should apply. And that's those my two little housekeeping things. I'm going to turn it over to make sure I pronounce your name right. Dr. Jasmine Gonzalvo, is that correct? Assuming it is, right? And she's going to
Yes,
thank you. Thank you, Doc. And she's going to lead today's panel on adapting and thriving successful strategies for pharmacists in a season of change. And that's being brought to us by our SHC department, who always leads our last Friday panel. No need to read bios because they're up there, and I know you guys are all smart, so I'm going to turn it over to Dr. Gonzalvo.
Thank you, Brandon. I'm going to try to navigate in person and online. So for those of you who have been with us online, hopefully you've been able to catch all of the fantastic sessions that we've had thus far. I think this session is really going to bring everything together. Everything has come together really nicely in terms of talking about pharmacists in a season of change. Where are we going? Where have we been? What do we need to do? I think that kind of adequately describes this sort of season of change. And all of our speakers have so nicely captured different nuances to the seasons of change. So the panelists that we have on with us today are going to, I think I'll ask the panelists before you provide any responses to just let's do some quick intros. Some of us have already been introduced, but there I know of at least one who hasn't been introduced yet. And good to see you, Donnie. So why don't we start there? Donnie, do you want to do a quick intro of yourself, and we'll have all of the panelists just kind of say who's going to be answering questions.
Hi, Jasmine. Thank you. Once again, it's good to see you. So far, the summit has been great. I enjoyed listening to all the speakers of Allison and Charlie early on as two panelists. Hi, everyone. My name is Donnie John. I'm the executive director of a nonprofit charitable pharmacy called Nova Script Central. We provide life-saving medicine and health services to the uninsured. I have a very diverse career in pharmacy and healthcare, where I've been in academia, I've worked in startups, and now my latest journey is really working in the nonprofit world, really serving as a patient advocate to helping uninsured individuals and tackling health disparities. So I get to work with the National Minority Quality Forum and a lot of great colleagues across the country in addressing the health disparities space and really advocating for where pharmacists can really play a vital role in the change of these issues.
Thanks, Donnie. Allison, you're kind of next on my screen. Do you want to? And then you can popcorn it to someone else after you.
Oh, sure. Thank you, Jasmine. Good afternoon, everyone, or if you are not on the East Coast, good morning. I'm Allison Hill. I am Director of Professional Affairs with the American Pharmacists Association. The American Pharmacists Association is the oldest and largest national pharmacy association in the United States. And what I do in my day-to-day is advance the practice of pharmacy with sustainable practice models. I am a pharmacist by training, and I have quite a bit of experience in community pharmacy, which is my favorite practice area. I am based in Washington, D.C., and I enjoy volunteer on several national pharmacy organization boards, and also am very active with the D.C. Board of Pharmacy. And I will popcorn it over to Charlie.
Thanks, Allison. Good afternoon, everyone. Charlie John, I'm Senior Director of Healthcare Policy and Strategy for Walgreens. I've been with the Walgreens Company for close to 30 years now. Started off as a pharmacist in our stores, probably the job that I enjoyed the most. But what is really great about my current role is that I work on public policy that allows our pharmacists to do more to address healthcare access and reduce healthcare disparities. So a lot of what we are talking about today. So thank you. Great to be here. And I don't know if there's anyone
Yeah, I didn't know if maybe Chinny and Ashley just wanted to give a little bit of background on who you are and who you're representing.
Sure. My name is Chinny Okachuku. I am the director for senior director for quality improvement and equity here on the SHC team. And SHC is the Center for Sustainable Healthcare and Quality, one of the business units at the National Minority Quality Forum. We are the co-conveners of of the summit, and we are excited to have you all amazing panelists and participants in the room, hoping that you take something away from here as you continue your amazing work as community pharmacists. Thank you.
Ashley, did you want to say anything?
I'm just here for background support, but I'm Ashley Hill with MQF. I'm in marketing and operations, and I help to manage the webinar. So thank you everyone for joining us in this very important topic.
And your role is very important, and that's why I didn't want to leave you out. So thank you. Okay. I am moderating just a series of questions for our panelists today. We've heard from a couple of them, but I think really just wrapping everything together nicely for some consistent messaging and additional perspective here. So the question I'll start with now is, what are some emerging areas in healthcare where pharmacists could specialize and what training would be required? Anybody can take that.
Sure, I can start and then I will let Donnie and Charlie finish the question. But some emerging areas would definitely be immunizations. We see where pharmacists are making a tremendous impact on providing immunizations, the majority of them that are administered in pharmacies versus other locations. There's also test and treat. Test and treat involves testing for COVID-19, influenza, and also treating with those medications. There's HIV, PEP and PrEP. There is opioid medications for opioid use disorder, hormonal contraception. Also, medication therapy management has probably been on the scene the longest. It depends on what state a pharmacist is in, really depends on how much additional training is needed. Some of these services can be provided because it's in the Pharmacy Practice Act for that particular state. And then sometimes it can also be added based on collaborative practice agreements, statewide protocols, standing orders, and prescriptive authorities.
Perfect. And that lines up so nicely with what you presented in more detail earlier, Allison. Thank you so much. Donnie and Charlie, do you have anything to add there?
Sure. So I would say that it's a little bit different than what Allison had said, where there's a big role for pharmacists to be advocates. I like to tell everyone that our role is to be a chief patient advocate for our loved ones. So when we have that framework as our primary responsibility, that opens up a lot of doors. So when we talk about diabetes or other chronic illnesses, we have to understand how to reduce the barriers of accessing care. That's not just knowing about the medication. It's knowing how the health system works. How do we help our elderly, family members gain access through Medicare or Medicaid to the service that they need? So we have to do a lot more to understand the why behind the what. We all want to do services, but we have to understand the why of how things are delivered and understand the context. And there's a lot of training programs out there that allow you to really, learn more about it. But to what Dr. Sachdev mentioned this morning, we have to go outside the pharmacy world and speak to other communities, other professionals that understand their perspectives and bring that together, where there are many opportunities in the world of diabetes or oncology for pharmacists to use their critical thinking skills to be that patient advocate. How do we reduce barriers and bureaucracy to help empower our communities to get the services that they need? So it's not just pure clinical skills, it's really that the knowledge based from a public health perspective and a policy perspective. And one thing that helps is just showing up. Volunteerism is a huge part of helping you get that experience needed to become a change agent.
Thanks, Donnie. Charlie?
Yeah, what I'll add is I think Allison gave a great list there. I couldn't do any of those things when I practiced. So wow, how far we've come. But I think what I would like to say is that we're trending towards a greater recognition of pharmacy playing a more formal role within healthcare delivery. So yes, those services can be done, but I think we're being thought of and considered in sort of the realm of pharmacogenomics. We're being thought about in the realm of delivering precision medicine. We at Walgreens have a specialty cell and gene therapy center where our pharmacists are involved in this highly complex therapy. Our pharmacies are now involved in clinical trial design. I think we all know the challenges that are involved in the current clinical trial model. Not a lot of people participate. Not a lot of people from enough diverse backgrounds participate because sometimes they don't have heard about them or they may be scared to participate in some of those. But imagine being able to walk into your local pharmacy, and Allison said it earlier, 90% of Americans live within 5 miles of a community pharmacy. And another stat on top of that, 60% of Americans, they seek the pharmacy for as their first resource when it comes to non-emergency care. So we are thought about and relied upon in that way. So in thinking about how you can make clinical trials more accessible and understandable, to be able to walk into your local pharmacy, your local Walgreens, and find out about a trial, perhaps participate in the trial from that site. It's just some newer, more creative ways, but things that are so important to healthcare delivery and healthcare outcomes for pharmacists to be involved in that. So some really, really exciting stuff. A lot of it will rely on advocacy and policy work that Donnie alluded to. So that is part and parcel with all of it. And then to your point about the training question, it's people like you, it's people like Allison and her organization that run the Board of Pharmacy Specialties and all the sort of continuing education and education that is needed for these newer services, their immunization program, their test and treat program, prep, and how to pharmacists for participating in clinical trials. So there's a lot of great work that's done from organizations like yourself that provide pharmacists with the training that they need to be ready for that.
Awesome. And this is a little adjacent to that, but if you have something to add, so many pharmacists are interested in expanding their scope of practice. And what advice would you have for those seeking non-traditional career paths? We're talking about innovation, we're talking about sort of the future of pharmacy. So what are some of these non-traditional career paths and how can they make a compelling case to potential employers to sort of forge new opportunities for pharmacists?
So I think that's a great question. And the first step is on knowing what's important to you. What is your why, right? We all talk about we want to work in a hospital setting, in a community setting, a pharmaceutical industry. We have different settings that we want to work in. But we have to understand what is it that we want to do once we're in that setting. And that I go back to the framework of being a chief patient advocate for you and your loved ones. How do you want to advocate for your family? So knowing if you want to focus on a specific disease like oncology. One of the biggest reasons for people to go into personal bankruptcy is medical debt. And we know the financial toxicity that's associated with oncology. But how much effort are we putting in to really address the financial toxicity issue for our patients? How are we addressing those barriers? So there are a lot of domains that we can address, whether it be diabetes, oncology, or Parkinson's disease, Alzheimer's. Once we know that main focus area, then we need to look at what are the components that contribute to this challenge. How do we help our families and our communities address those concerns head on? But really getting engaged with community organizations, being part of nonprofit boards or working with advocacy groups, working either within the SIGs of APHA or joining other professional groups that have subgroups and advocating for how do we really look at the holistic picture. When we talk about patient-centered medical home, we as pharmacists have to understand what are all the different moving parts. We can't just be complacent with our little piece and thinking that we are super clinicians and not understand how empathy plays a role in making the whole thing work. Bishop Carter alluded to the building of trust, and trust starts with us understanding what we want to do for our families and our communities. So having that sense of purpose helps you navigate and guide you as to what are those training opportunities or ways to get involved. Community advisory boards are one way to be part of clinical trials because our community advisory boards that are set up by pharmaceutical companies and research institutions, they're always looking for volunteers, people to participate. I sit on a lot of these boards. Not many pharmacists are on those boards with me because part of it is just seeking the opportunity instead of waiting for the opportunity to seek you.
Yeah, Donnie, I definitely agree with that. And that pairs really nicely with what Gloria was saying earlier of we need to put ourselves in other spaces and define our value and demonstrate our value in other spaces. So I think that that messaging is loud and clear. Allison or Charlie, did you want to add anything to that? I can repeat the question. Many pharmacists are interested in expanding their scope of practice. What advice do you have for those seeking non-traditional career paths, and how can they make a compelling case to potential employers?
Well, I was going to add to what Donnie said about getting involved. It's not only getting involved in your organizations, but when you get involved in your organizations, whether it is APHA or any of the other pharmacy associations, you're at the table where these conversations are happening. You have an opportunity to discuss your ideas so you can go back out there on the bench or in your practice setting and start implementing some of these ideas. I like the fact that pharmacists are getting out there and not just in pharmacy only settings. When we think of primary care or we think of clinical trials, we've got to make sure that our collaboration with the other healthcare providers is increasing, because we can't say, oh, we want pharmacy to be a part of it unless we're already out there and sitting at the table.
Yeah, Allison, and arguably, I might have a biased opinion right now, but public health for sure is a space where pharmacists are really needed as well. And Allison, I'm going to put you on the spot for a second, for your APHA kind of perspective on where pharmacists, and we have a lot of learners in the room too, of what are some APHA opportunities that kind of are in the same space of almost like a non-traditional career path, or really just kind of forward thinking or creating new opportunities for pharmacists is at APHA. What exists there?
Well, we are lucky if you want to, if you're a learner or if you are a seasoned pharmacist or even a pharmacy technician, you can go on pharmacist.com and complete the career pathways survey, and that actually shows you what with your abilities, what different non-traditional career pathways you may be looking forward to. So I think that that's an opportunity, but the other thing is get involved, volunteer. We have different communities, no matter what your practice setting is, whether you're a researcher, whether you're a pharmacy technician, whether you're a student pharmacist, there are opportunities, whatever you're interested in or think that you may be interested in, you can get involved and learn from people who are already doing that in their practice area.
Thank you, Allison. I'm gonna ask you one more question while we're here, Allison. I was also gonna ask you, so what is APHA doing, to your knowledge? I know you know, I don't want you to speak for the entire organization, but I'm sure you have some perspective on how does APHA currently collaborate with other non-pharmacy organizations to sort of, you know, make a bigger imprint with pharmacists. So what are some of your efforts or initiatives in that space?
Sure. Well, one of my main practice areas in my role is immunizations. So I sit on quite a few immunization coalitions that are across the United States, and I speak up for pharmacy and the practice of pharmacy. I've spent the past 2 years educating on the abilities of pharmacists, student pharmacists, pharmacy technicians, because unfortunately, a lot of our other healthcare providers didn't even know that pharmacists were even had a 20-hour training in order to do immunizations. They did not know that. So I have spent the past 2 years talking about that. Also, what I do get to do is with our partnerships with the other healthcare professional organizations, whether it's nurse practitioners or physicians, or even patient advocacy groups, I go and talk to them about how pharmacists can improve and help their different membership bases by what we do, by pharmacies being accessible, what we can offer, and how we can collaborate as a part of the healthcare team.
Awesome. So you are doing it. That's
Not saying me only, I'm just sharing what I get to do as part of my role, not all of APHA.
It's fantastic. And I imagine that there are similar efforts throughout the organization as well.
I can only share what I do.
Right. And which is wonderful, Allison. Okay. So this one might be more geared towards Charlie. What regulations need to change for pharmacists to expand their role in patient care? Maybe top two.
Yeah, thank you. Allison is one of the hardest workers I know. So there you go. I think the first, so before I probably get into a specific policy, and I might have sort of said it before, I think we need to get to a policy-making base that needs to acknowledge that pharmacists should play a greater role in healthcare delivery. They should be viewed as a healthcare provider like many other disciplines are. I kind of feel like that's missing a little bit. Like you ask people and maybe they say, like, yeah, I think a pharmacist is a provider, but not really. Like certainly if you look at the Medicare manual and you look at other things, it's not. But also I think when policymakers are making healthcare policy, we see it in pieces of legislation all the time. There are bills that address things that affect the physician community or the nurse community, but it won't affect the pharmacist community. So I think there's still a lot of that needs to be really buttoned up. So I think if we start from that kind of basis for policymaking, it's easier to get by because the proof is there. The data is there that shows that when pharmacists are involved, it's only better and outcomes are better as a result of it. I think where we can where specific policy areas now that we can move to, one, totally on this idea, but there is an effort at the federal level to recognize pharmacists as non-physician providers within the Medicare system. So that might come as a surprise to many people. In the Medicare system, pharmacists are not designated providers. They are things like DME suppliers, or they are things like mass immunizers, but they're not considered a healthcare provider. So the effort at the federal level is to have there's legislation that we hope will soon be introduced in the new Congress that will, for the first time, formally recognize pharmacists as non-physician providers in the Medicare system. And what that would allow them to do is, because they're authorized at the state level to perform a host of services that Allison alluded to, and each state is different, but only what they are allowed to do at the state level within their state license is what they can now be able to bill Medicare for. So you are giving the opportunities for seniors to access these services, get them where they sort of want it and where they need it. So that policy will go a long way to shoring up some healthcare disparities that are out there. The second sort of thing that I think it's been alluded to earlier is that you do the service, you need to have the payment for the service that keeps it sustainable. And that's not too much to ask. Every other provider, when they do a service, they bill for it and they get paid for it. Why? That covers their cost to be able to do it so that they can keep doing it. Pharmacy is sort of that area where it's not. We've made some progress at the state level. There's some progress with certain direct arrangements with payers and insurers, so that's growing. But we need to have more formalization of the payment for services. Now, that's not only the payment for patient care services like we described, but also for the prescription drugs that we dispense and that we counsel and help patients do well on. I practiced at a time when that was adequate. The payment for prescription drugs was adequate, and we were able to continue to deliver medication, counseling, and therapy management to our patients and help them do well on their meds. We've seen kind of an attrition, but an evolution of that payment system, if you will. And pharmacy benefit managers are a big part of why that has happened. I started practicing right around the year 2000, and then ended practicing around 2010 or 11. If you think about that time, that is kind of the rise and evolution of pharmacy benefit managers, because that is when managed Medicaid really kicked up. That is when we established the Medicare Part D program. So you had pharmacy benefit managers more involved in the prescription drug supply chain. And as they've gotten more involved, we've seen an attrition and a decline and a pressure on reimbursement to pharmacy, to the point where they're not able to sustain their businesses. They're not able to cover their cost for running that operation, not able to cover the cost to acquire the drugs that they have to dispense to patients. But our patients rely on us. We heard from Bishop Carter earlier, and Donnie knows all too well. These communities rely on the pharmacy. They're a lot of times the sort of, if not only healthcare provider that they seek, the one that they seek there the most. So when those pharmacies can't sustain themselves, they unfortunately have to close sometimes, leaving those communities in the lurch. So we need policy that can help secure that aspect of this industry. Letting the pharmacist, so there's the two sides of it. You allow the pharmacist to be able to sort of do more in healthcare. It's proven to show that they can really make a difference. And then you ensure that they're paid adequately for those services so that it can be sustained, and then communities can continue to access those services.
Thank you, Charlie. Donnie, I think I'm going to go to you, and I'd love to hear your perspective here on what reimbursement models are working or not working for pharmacists at this point, and any insight you have there.
So before we get to the pharmacist reimbursement, I think reimbursement is a challenge for all disciplines. So when we look at healthcare as a whole, physicians are struggling in terms of getting adequate payment for Medicare, Medicaid services. So you have to think about when you go to advocate on your state capital or here at Capitol Hill in DC, everybody's coming with their own set of problems specific to them. But when we look from a patient perspective, the patient at the end of the day, they're looking for help. And when you have pharmacy deserts and medical deserts, they don't care about your provider status or your reimbursement rates. They're looking for genuine help and care and compassion. So we have to not only be present when it comes to Pharmacy Hill days, we have to be present for the other days of advocacy to advocate access to healthcare services. So when the medical community is going out talking about reimbursement reductions on their perspective, we as pharmacists need to highlight how that impacts when a doctor's office isn't available to provide care for patients, how that impacts pharmacists and how pharmacists see the negative impacts in terms of quality outcomes for diabetes or other chronic illnesses. A lot of times we keep going to these silos of just advocating for our own specialized interests without thinking about from a patient community level perspective, how do we bring the advocacy together to focus on this one thing has a domino effect on everyone. So if the doctor can't see patients, the pharmacy can't fill prescriptions, the pharmacy can't provide services. It's not just independent of each other. That's the same reason why for days when we advocate for diabetes awareness, Parkinson's awareness, there's a celebration every month. We have to show up and talk about the disease and how our patients, how our community members are impacted by the illness and the cost burden of the illness, right? If you have to see 5 specialists, that's a lot on the community member. How do we talk about improving access? So from a reimbursement standpoint, there are programs across the country where, Allison had on one of her slides earlier showing the variety of states that reimburse pharmacists for activities. But at the same time, if you are a pharmacist and you become a certified diabetes educator, a certified asthma educator, there are these professional designations that are outside of the pharmacy world that other healthcare professionals can get. There's billing codes to use for those. There's chronic care management codes that you can bill for your services. So we'd have to look outside of our own to think about, once again, how am I going to be an expert within a specific domain to truly advocate for my community? And working with physicians and other clinicians to think about how do we collectively look at value-based care, reducing cost burden, because when you have the shared savings models and all these new business perspectives, we as pharmacists have to be informed, and look at how do I help you save money so it helps my community. We kind of look at this as a transactional thing a lot of I need to get reimbursed to do all these other things versus how do we compound all these efforts together so we collectively get paid, but it helps the community. So we have to have that patient-focused, framework from the beginning, and not kind of the legacy stuff that we've always been doing, but we haven't seen much progress. Oftentimes I ask my students about the Astral Project, and they're like, "What is that?" I'm like, 20 plus years ago, we show the proof of value of pharmacists and outcomes in a community setting, but that research is pretty much mimicked year after year in poster presentations all across the country. But how much progress have we made from the Astral Project to now? So we need to evolve in our messaging of how we are adding value by showing up to help our other colleagues in terms of having a unified message, not just a pharmacy only, because when we need them to vouch for us, they have to know that we were there for them.
Yeah. Really important centering message, Donnie. And you know, I looked at Jake over here while you were talking, because so much of what Jake said too was also just really flipping the script in terms of service provision and quality of service provision, of really being the heart of where reimbursement really needs to come from moving forward. You know, you mentioned I was in accounting classes. It's really the operations costs versus the non-operating costs that we really need to focus on to really build a sustainable model. So yeah, that messaging is coming through loud and clear from today. I want to pause here just for a second. I have a couple more questions, but I want to open up the to the floor to see if there are any questions for the panelists here or online. I think I saw a couple online, actually. I'll start with the room first, but then I'll read this one. Okay, seems like we need farm influence to reduce the barriers of, especially from an immunization perspective, age restrictions and Medicaid and insurance restrictions. Thank you for encouraging farm providers to speak up for their empowerment. We desperately need farms the freedom to operate effectively. Okay, maybe more of just a comment. Laura Lee says, Donnie, I wonder if you could share about the DEEP program at Ark Church and the role of pharmacists and residency program participants. Yeah, so Donnie, more of the work of Bishop, who spoke this morning, and maybe just talking about the integration of learners. I think that would be nice. Thanks, Laura Lee.
Sure. So, you know, Bishop Carter was amazing this morning in talking about the need and the support that his church has been providing for their community. And so my organization, Nova Script Center, we are a nonprofit pharmacy. We work to serve the uninsured that live in Northern Virginia and making sure we reduce barriers to accessing life-saving medicines and health services. The challenges that we see here are no different what's in Baltimore or any other part of the country. So what we've done through all of our work is we have created educational programming, because we do a lot of health education out in communities. And, you know, through all those experiences of being directly in the community, we want to have pharmacists go out and be visible. So we created a program with National Minority Quality Forum and the Center for Sustainable Health called the Community Pharmacist Ambassador Program. And that program, it allows pharmacists to get connected to community groups that are part of the Faith Health Alliance or the Hair Wellness Warriors, or their barbershops and hair salons. They're all focused on having experts come in to teach about health. You know, as pharmacists, we're storytellers, but we're never given the opportunity to tell the story. We're always thought about, oh, you could only know about the drug. I can't tell you about the diabetes drug if I didn't understand the disease. So when we go into communities, we teach people about this. We understand the social stigmas, the cultural barriers, and we address those head on. And we humanize that perspective of having pharmacists as trusted confidants for community members, going into the faith community, going to the hair shops and hair salons to provide that messaging. Through that collaboration with the Faith Health Alliance and the Hair Wellness Warriors and Nova Scripts, we have a diabetes education program that it's the first in the country that's really translated into multiple languages, meant to be delivered directly to communities. That's engaging, that's realistic. You know, most of our patients work 2 jobs. They don't have the luxury of time to follow the CDC diabetes prevention program, where there's a lot of great content, but it's not applicable to them because of their struggles. So with our diabetes education program called Driving to Empower Education for everyone, we have a lot of acronyms, so the acronym may be a little off right now, but that is a module, that a curriculum being used at the Ark Church, where we have over 35 participants coming in on a monthly basis to learn about diabetes. We focus on lifestyle changes, and it's all pharmacist led. The pharmacists and pharmacist students are coming in and teaching based on the curriculum that we designed to help engage the community, where we track health metrics. We track A1C. You know, Safeway Pharmacy is able to come in and do immunizations. They're able to help provide A1C monitoring. And then we track blood pressure, waist circumference, and have all these clinical metrics. And I could tell you that people have lost weight. They've seen improvements in their staging for hypertension and for diabetes. So it's really humanizing the education, and having pharmacists lead it is very important, because people see us more as now trusted messengers providing real content, you know, going out of the community. And we're hoping to continue the program with Bishop Carter and his church and expand to other churches. But our diabetes curriculum right now is being used, you know, in a variety of different settings. We've done it for many years, and we have tremendous success where people have been able to maintain weight loss, maintain blood pressure control, but most importantly, maintain the healthy habits that they were taught. because we come from, different diverse backgrounds of underserved communities ourselves. So we know the struggle. So we've worked to design a curriculum and a solution that addresses that struggle from our perspective.
Thanks, Donnie. Okay. I think we answered both of those questions. Let me just check the chat real quick. Nothing there. Is there anything
Jasmine, while
here
you do that, I was gonna add a little bit to what Donnie said.
Sure. Yes.
I think they asked the question about residency programs, and then you asked the earlier question about how can pharmacists sort of prepare themselves for career paths. Like, I think there, if you go into community pharmacy, or it could be any path you take, don't just think that that's your job for the rest of your life, and that's the only thing that either that organization or that company can offer you. There are many ways to sort of upskill and build on your ability to deliver different types of care. I know Donnie personally has great programs at Nova Scripps Central with his residents and fellows that are really training the future pharmacists to be able to go out in those communities and deliver that care that he mentioned. And this didn't happen again when I practiced, so it was too long ago, but we have close to 30 community pharmacy residency programs. And this allows our future pharmacists to not only work the bench and have that experience, but to be involved in much more like higher level patient care services, as well as collaboration with other healthcare providers in health systems to deliver sort of a more comprehensive roundabout care. So those are opportunities that folks should seek to get to a higher level of healthcare delivery, and also organizations. I mean, certainly again APHA, but I know when I did something that I did have access to at Walgreens when I was a pharmacist, we had our own diabetes certification program. We had our own HIV/AIDS certification program. I went through all of those and I got certified, and I was able to deliver care in a much different way and in different settings as a result of it. So there are a lot of these opportunities for pharmacists to sort of get to another level and be able to deliver specialty care.
Allison, did you want to add anything there? You can say no. I just wanted to check.
I will say no. I feel like Donnie and Charlie added and closed the question.
Perfect. Well, Allison, I do have another question for you though. One of the ones that we kind of prepared beforehand, and which I'd love for you to comment on, is this idea of the digital health experience, right? The digital health patient-centered services. So I just kind of want to focus on that in terms of pharmacists and doing those types of digital health centered, patient centered type services, and what the integration of that looks like, Allison, or if you could just comment a little bit more on that.
Sure. Well, the digital health services, I think of them as digital therapeutics, and it's more than just the continuous glucose monitoring. It's software that delivers a clinical mechanism of action, either alone or in combination with the standard of care treatments. So this is another way that pharmacists can get involved and learn and use technology to their advantage, because pharmacists are able to teach patients how to use this digital therapeutic. They're able to coordinate the therapeutic with maybe another medication the patient may be taking, and also really educating the patient on their disease status and how it will be affected once they use this digital therapeutic. I think it's an underutilized way that pharmacists have not gotten involved yet, and I hope to see more pharmacists using these as offerings in their patient care services. And
Go for it, Donnie. But yeah, thank you, Allison.
So to piggyback off what Allison said, there CVS, Express Scripts, and Walgreens all have digital health formularies where they help identify, what type of solutions are meaningful for patients, whether it's for diabetes, for mental health, for musculoskeletal. But not many people know that a CVS has a digital health formulary, or a Express Scripts has a specific formula, and there are pharmacists that work behind the scenes to create those programs, to highlight and vet the content behind it. Same thing with Walgreens. Walgreens is doing a great job of explaining to patients and community members what type of tools are at your disposal to kind of shepherd which ones are legit and which ones are not. So it's important where we have to look at the resources that we have internally. And I always encourage my students and others to make sure you read your company emails. Know what your entity, your employer is actually doing. Because a lot of times we're living in a bubble of just kind of doing what we're doing, but we don't know what's happening outside of our specific roles. For companies like Walgreens and CVS and large health systems, there's so many moving parts, and digital therapeutics is a big part of it. There's also the Digital Therapeutic Alliance, which is the industry organization that kind of highlights advocacy for digital therapeutic products and solutions. If you look at their members, it's a host of different entities. I put it in the chat for everyone to look at, but they have specifics of the products that they're providing, promoting, whether it's for ADHD, for mental health, music therapy. These are all innovation where, once again, we have to be proactive in looking for these things, finding out if this is one of my areas of interest. If I love technology, well, how do I become an expert in it? I need to go out and do it because I started my career in academia and I transitioned into the startup world working for tech companies, but there was a lot of no's. Like, what are you as a pharmacist supposed to do for me? How do you know any of this stuff? And it's just pure persistence. The focus on, I'm here to advocate for my patients. This is how I need to do it. And, understanding the business case. That is a huge culture shock for pharmacists and clinicians to go from pure patient-centric to the business aspect of, tell me the ROI. Give me the ROI, and you have to get better at it. We can't ignore and think that we're just going to be perfect clinicians. We have to understand the whole spectrum of that. But definitely check out the Digital Therapeutic Alliance in the chat as a resource, as a tool to highlight companies that are working in this space. So when pharmacists are looking at how do I get involved, knowing these trade associations, knowing who are their members is also going to be just as important to get that foot in the door.
Awesome. Let me check for new questions. Please comment. We encourage patients to be aware of allergies and to obtain printouts of medication fills in reverse date order for MedRec and awareness and removal of conflicting meds. EMR notes also contain sometimes 10 or more meds no longer used or hints of polypharmacy. Does anybody have any comments on that?
So one of the things that my organization has done is that I'm blessed to have very culturally diverse staff and team. And because we represent a lot of ethnic backgrounds, and many of us are caregivers, we have elderly family members that are on multiple medications. We create tools that are really looking at benefiting not only our family, but everyone's family. We created a educational tool for MedRec that's translated, that's visually engaging to help people identify how to be more informed of what medicines they take. Instead of telling me you take 3 blood pressure pills and they're all white, knowing, okay, what color is the pill, but also which medication are you taking for your heart versus your brain versus your lungs is extremely important. And so having the basics of addressing health literacy is going to be the most important thing, encouraging patients to understand why it's important to know, these things such as allergies, as to, are you allergic to food? Are you allergic to a specific medication? Diarrhea doesn't mean it's an allergy, right? A stomach upset doesn't mean it's an allergy. So knowing how to explain, on a patient level and also from a cultural level, not everybody knows how to express what an allergy is. So differentiating when we are engaging with community members, whether it's in the hospital setting or in a community setting, you have to really be able to effectively communicate what needs to be said, but also know that they're looking for information on Google. They are not going to just listen to you because you're the so-called expert. You really have to hear them out and really help them in terms of identifying what's going on. And I'll put in the chat the link to our resource page that has our translated medication consumer log that's available for anyone to use. It's in 10 different languages, but it's really important for us to know how to get patients to understand what they're taking, why they're taking it, and when to take it. And it can't just be small font printed little handouts that they've been accustomed to doing, versus kind of really knowing how do we build solutions that are meant to help our communities that have different learning capacities.
Thanks for sharing
That's the
those.
one thing I'll add. And I don't know exactly if this was the question, but I think how pharmacists can be really effective in this regard, it kind of stems from like sort of the access and interaction points that we were making before. Of course, we're within 5 miles of most of the population, so there's access there. But the number of interactions that a pharmacist has versus sort of any other provider, if you compare for a Medicare patient per se, a Medicare patient visits their pharmacist 13 times a year, and they visit their primary care physician only 7 times a year. If you're looking at a high-risk Medicaid patient, that number is 35 to 7. So every one of those interaction points, what I want to highlight is that is our opportunity to be able to have those conversations with the patients so that we do clean up these issues and make sure that we have the best information available. You supplement that with when you do medication therapy management, when you do medication synchronization. We have a transition to care program for when patients leave the hospital and go back home, how we make sure we clear up their medication list. So the pharmacist is well positioned to be able to do that. It may also go back to, whether these services can be sort of codified and billed for too, would really help them to be able to formalize the program more.
Awesome. Yeah, and we've talked about a lot of different terminology in this space and the landscape and everything. And one term that hasn't come up that I think some of us may be familiar with, and some of the work that's been published fairly recently, is pharmacoequity as well, and looking at disparities across the pharmacy landscape. There are some really good publications if you look at the term pharmacoequity and what needs to be done in the pharmacy landscape to prevent pharmacy disparities as well. And so that pairs nicely here as well with everything that's been said. So we only have about 8 minutes left, and I have a couple of questions, but I think what I want to do instead is really just, kind of rounding things out with the topic here today. So the topic here today is adapting and thriving, right? I think we've honed in on that so well. Successful strategies for pharmacists in a season of change. There's so much that's changing right now. And we've talked about opportunities, we've talked about difficulties, obstacles, policy, we've talked about so much that I just want to give each of the panelists a little bit of time. Anything that we haven't talked about, I think that we've hammered home some really good concepts really consistently. Is there anything else, or just your parting message in our last 8 minutes here for each of you? I think I'll start with Allison, just kind of what you kind of want to say, either that hasn't been said or just your closing remarks.
Sure. I think we are very passionate about pharmacy, but we can't forget about what happened during the pandemic, where pharmacists and pharmacy personnel were in the news cycle about burnout, about not having the well-being and all the issues that surround that, and showing and highlighting the fact that a lot of pharmacists were leaving the profession because of burnout. And I just wanted to talk about a couple of resources, because we can't talk about progressing and going what we can do to improve the profession of pharmacy and making sure patients have access to care without making sure that we're healthy ourselves and we have the resources we need. So there are resources on pharmacist.com, including pharmacy workplace and well-being surveys that you can fill out anonymously, that are actually sent over on a quarterly basis to your state boards of pharmacy, and they can actually adjust and make recommendations based on those results. There's also a well-being index, which is an online screening tool to see if you do have burnout, and also how to beat burnout and build resiliency tools. And I think we have to look forward, but we just make sure that we are keeping healthy. And that's my closing message for everyone.
You're right, Allison. We didn't check in with ourselves there for the self-care. We asked ourselves to do a lot of things and then didn't take a second to really look inward. So Allison, I appreciate you bringing that up. Okay, Donnie, do you have anything new or closing thoughts?
Yeah, so there was a question earlier, I think in one of the sessions, talking about critical care, creating critical care pharmacies in terms of when pharmacies are closing down because there's critical care hospitals. So the one thing I want to bring out to the group is that we have what's called the National Association of Free and Charitable Clinics. There are over 1,400 safety net clinics and charitable pharmacies across the country in all states, serving the uninsured and underserved communities. The 1,400 clinics see about 2 million patients on an annual basis for all sorts of illnesses, not just acute, but also chronic illnesses. And it's a perfect opportunity to as a pharmacist to volunteer your services and to get engaged. We have a lot of great, clinics that are the members of the National Association that provide high quality care. We have quality standards that we submit our data to, and we get evaluated in it as to, are we providing the best practices for chronic, cardiovascular disease management, for mental health services. But I'll put in the chat the link to the National Association of Free Clinics. But as I mentioned, there are over 1,400 clinics across the country that are providing really important care to the most marginalized and the most needy in urban, rural, and metropolitan areas. They need volunteers to help out to further their missions. You could serve as a board member, you could serve as a pharmacist, you could serve as an advocate, just helping to raise the level of awareness of how to get involved and how to be, once again, being a strong patient advocate for your community is extremely important. Signing up as a community pharmacist ambassador is another way to get involved directly in the community. We create educational materials that the community ambassadors have access to, and then we ask those ambassadors to go out and deliver that message to the Faith Health Alliance or the Hair Wellness Warrior Network. So instead of you trying to go find an opportunity to speak, we're trying to set up opportunities and say, hey, can we have a talented pharmacist come out and speak on our behalf? So you get the slide deck, you get the information, and you're able to build that relationship directly in the community, because we want a lasting solution, which is you helping the community and us just providing you with the tools to help you get started. So I encourage everybody to sign up to be a community pharmacist ambassador, and also to check out the National Association of Free and Charitable Clinics to find a local free clinic or charitable pharmacy in your neighborhood that can really help you, that you could provide a lot of value. And that's how you get those non-traditional career paths, because there are a lot of volunteers that come from all sectors. So that's a great way to network with new individuals, new leaders from different groups that you may not have access to, because they're all mission driven. That's why they're a volunteer at the free clinics and the charitable pharmacies.
Perfect. Thanks, Donnie, and thank you for bringing up. And Courtney actually has some a business card for an opportunity for volunteer pharmacists. If you're interested, Courtney's right up here. So Charlie, there's a little bit of time, so 3 minutes left for your closing thoughts or any new info that you want to bring up.
Yeah, I'll certainly echo what Donnie said about the Community Pharmacy Ambassador Program. Pharmacists that I know that have participated in that program, it's been amazing. And it really can be a jumping off point for pharmacists to get much more involved in the community and do a lot of these things that we said. So hopefully everyone will look into that. I think I'll kind of touch back on what Allison said. It was an important topic and we didn't really get to bring it up all day, but sort of our workforce and burnout. I bet today we got a lot of pharmacists on the phone excited about the future of pharmacy, all the things that we can be doing and will probably be doing in the future of healthcare delivery. So I think that's exciting. But we have to feel that our pharmacists feel like they can do this. They have the time to do it. They have the resources to do it, the training to do it. Certainly, my world can do a lot to help that. A lot of policy can help us get there. Certainly, we can have improved reimbursement that allows us to put in more staff and more resources. Certainly, there's other policies that can make the day easier for a pharmacist. Like you can take some of the work out of the pharmacy that's not involved, that doesn't involve the sort of clinical judgment part. Things that can just make their day a lot easier. So policy can really solve a lot of that. But that's sort of half the story. We as employers, we as fellow pharmacists, we have to really think about, how we improve their experience. And so we've done a lot of introspection and talking to our folks and what they feel that they need. We use resources like the ones that Allison alluded to, and also partner with her organization on how we roll these out. One of the most, I feel, unique and creative things that we've done is we created our Dean's Advisory Council, where we have partnered with all the deans of the schools and colleges of pharmacies, but we have a particular council that's made up of 17 of them. And what we do is we come together quarterly, and it really is about listening and learning. They are training our pharmacists and our future pharmacists and putting them out in the world. And we may be the recipients of them and where they want to work. And we want to ensure that what got them interested in this field and excited about it and what they learned and were taught to what they could bring to the world in terms of healthcare, that we deliver on that. And so it has been incredible, the learnings that we've gotten. It's been just over a year. But through it, we've been able to, establish scholarship programs for students. We've expanded our residency programs and fellowship programs. So a lot of ideas that have come from that. But this is the other half of what the pharmacy community needs to do. We need to really think about what is the experience of our pharmacists out there, and ensure that, coupled with their excitement for doing these new and neat things, that they feel like they're in the frame of mind to do it.
Awesome. Thank you so much to all of you, and Charlie for those closing thoughts. I was just reflecting on everything that's been said today and all of the expertise and insight that everybody shared today. I think if nothing else, if you don't take away any statistics or any resources, I think one of the messages that can't be overlooked or understated today is that we have a lot of opportunities collectively as pharmacists to make an impact on public health, population health. And it's now our time to be demonstrating our value outside of, not preaching to the choir and going to other spaces to really demand kind of the value and the return that we have sufficient evidence for. We've talked about some of the ways and the innovative kind of strategies to do that today. So I just want to thank everybody. So if we can give everybody a round of applause again here. So everybody in the room was giving you huge rounds of applause. If you we have 15 minutes left here in person where we're just going to do some wrap up. We're going to hear from the Indiana Pharmacists Association. So if you're staying on, you need to go back to the original link that we were on for the first part of the day, because we'll cut this link off and then go back to the other one. So if you want to stick with us for 15 more minutes, we'll have one more update and then closing thoughts and just some, housekeeping CE stuff. But thank you so much to our NMQF audience here and our NMQF speakers. So thank you.
Thank you.